Dr. Shannon M. Clark here. I am a double board certified OBGYN and maternal fetal medicine specialist, and I want to take a few minutes to discuss fetal movement and fetal kick counts. It is a very common misconception or myth, I don't know what you want to call it, that as the pregnancy progresses, especially in the third trimester, that the fetus runs out of room and does not move as much. And that is simply not true. The fetus should move, roll, kick, all the way up until delivery. As far as when people typically start to feel fetal movement, it varies. The earlier end is around 16 weeks. The later end is around 22 weeks. If it's the first pregnancy, you may not notice fetal movement or perceive fetal movement until that 20 to 22 week mark. The more pregnancies you have, the more the patient tends to sense the fetal movement or recognize the fetal movement earlier in pregnancy. Now let's talk about fetal movements and fetal kick counts, which I'm sure many of you have heard about. Now there are two ways that fetal movement can be assessed by the pregnant individual. The first is qualitative, meaning they know the movement patterns of their fetus, when the fetus is most active, when it's least active, the types of movements that their fetus makes, and they come to learn these patterns over the course of the pregnancy. So they know what's normal for their fetus. And then there is the quantitative way, where you actually count fetal movements and or kicks during a predetermined period of time. The problem with fetal kick counts is this: no study utilizing any testing of fetal movement has been shown to improve fetal outcomes or improve adverse pregnancy outcomes or even improve the rate of stillbirth. And that's because it's a screening test. And with any screening test, there are false positives and false negatives. One scenario could be that the patient has decreased fetal movement based on their fetal kick counting. They go in and they get delivered at an earlier gestational age based on that, when there really was no indication. The opposite would be they did their fetal kick counts and they had the good fetal kick counts. They didn't go in and there was an adverse pregnancy outcome or even a stillbirth. So there are false negatives and there are false positives. And we don't have a false positive rate or a false negative rate for fetal movement or fetal kick counting. And the totality of the studies to date have shown that the unintended consequences of fetal kick counting outweigh any potential benefits. Yes, there are individual studies that have very positive conclusions or potential guidelines, but you also have to look at those studies and their design and the strength of those studies. And when you review all the studies together, it's just not there. So what do? I think that the qualitative assessment of fetal movement is key. And if you notice that there is decreased fetal movement, or you feel off, or you just intuitively feel something is off, you should go in. If you're just not sure, then you could potentially do the fetal kick counts. And that's where you go somewhere quiet, eat a small meal, lay down, focus on the movements, look for 10 movements in 2 hours. And if you don't get that, then go in. But again, there are going to be cases where you do all of that and everything's perfectly fine, or you do all that and it's not fine because the evidence just is not there to support any one way to assess fetal movement. Now, I want to close by saying this. I am not against people paying attention to their fetal movement and the patterns, but I want to also make it clear that doing the fetal kick counts, downloading an app to do fetal kick counts, is not guaranteed to prevent any adverse pregnancy outcomes or any stillbirth.